Welcome to today's topic on Introduction to Conventional Film Mounting and Interpretation. Before watching this video presentation, it would be helpful to read thoroughly the handout on film mounting procedures, helpful information. Please read this handout thoroughly for a complete understanding and ask your lab instructor if you have any questions. Mounting is an important step in the interpretation of dental radiographs. A radiographic image serves as a diagnostic aid that helps the dentist or provider to analyze the patient's level of dental health and/or disease. Dental radiographs that are mounted in correct anatomical order allow for a more thorough and systematic interpretation. So the purpose of this video is to describe a step-by-step procedure for mounting and viewing dental radiographs. The definition of film mounting is the placement of dental radiographs in a holder arranged in an anatomical order. The advantages of film mounting are much easier to view than single individual films. It decreases the chances of error caused by confusing right and left sides for the provider and the patient. Less handling of the radiographs, which can result in fewer scratches or fingerprints. It's easier to store versus being stored in an envelope. And it also helps when viewing films side by side. It allows for easier comparison between different views. Many times, films that are in a film mount, it's easier for the provider to provide consults and patient education, which is definitely enhanced by having films in a proper mount. Film mounts provide a means for labeling the radiographs with the patient's name, date of exposure, name of practice, and provider. Film mounting is utilized for intraoral films. And as you can see by this example right here, and examples that you have laid out during your lab, there's different sizes and shapes of film mounts. Film mounts can come in conventional cardboard with name, date, provider, the number of films, might be the name of the practice on here. They might come in a celluloid or maybe a plastic film holder mount. It just depends on the provider's preference. The important aspect is whether it's a single film, 4 films, or up to 20 films, that the films are properly labeled. When we look at films, conventional films, generally films appear as a black and white image. So an important aspect before we start film mounting is to have an understanding of the anatomical structures. And we're going to utilize this mouth model to review to where images would be mounted in a film mount. Looking at this model, you will notice, if we review nomenclature, that in the front of the model we're presented with the anterior teeth, and the back of the model is the posterior teeth, similar to how a film mount would be set up. You have the anterior teeth in the front, the posterior teeth on the sides of the mount. Also, if you notice, just like the jaws that are in front of us, the upper jaw is known as the maxilla, and the lower jaw is known as the mandible. This is the same way that we orientate our film mount. The upper films are the maxilla, and the lower films are the mandible. The films in between the maxilla and the mandible are showing just the biting surface or the crowns of the teeth that are exposed on the back teeth, known as the posterior areas. These are known as bite wings or interproximal films that help to show for decay in between the teeth. When we start film mounting, we usually start by mounting the interproximal bite wing radiographs on the patient's right or left side, and then we proceed to do the other type of films, which are known as periapicals. Periapical, peri meaning around, apical being the root of the tooth. So when we're mounting films, we have two types of films, bite wings and periapicals, which would be helpful for you. The next part that we want to look at whenever we look at a film, whether it's a larger film or smaller size films, because films come in different sizes. Some of them come in a size 0. This is a size 1. This is a size 2, and you'll learn later on there's larger sizes. Generally, it would matter based on the patient's size of their anatomy. A size 1 film fits better for a smaller mouth than a size 2 film. But either way, when we look at a film, there's a very important aspect about the film feature that we need to know for film mounting. It's known as the identification dot. This important aspect is usually found at the edge of the intraoral film. It will appear either as a raised dot that appears like a pimple, or if the film is positioned on another side, it will appear as a dimple, or it will appear very concave. This is an important orientation for film mounting because there's two different types of film mounting, and really it's a provider's preference. The type that we use here at the dental health programs is known as labial mounting. This type of mounting is in which the identification dot is convex. It feels like a pimple. So when we go to take our films, after we have processed our films and laid them out in a clear area on a light box, as you're seeing here, we want to orientate so that we can find on the films all of the identification dots, and they're usually in a upper or lower hand corner on the film. We want all of those dots to be convex for labial film mounting so that we can feel pimples. And that's the first thing we would do. It's kind of like a jigsaw puzzle. The first thing you would do is orientate to get all of the puzzle, the colored features up. And we're doing the same thing here. Think of, we want that identification dot up. So feel for that identification dot. Make sure that it's up. That's the first thing you want to do with all of your film before we do anything else. The next part that we would do with our film is we would find where those bite wing or interproximal radiographs are. Remember I said to you, you want to look at the patient's anatomy. The patient's anatomy will help you to find the bite wing radiographs. Bite wings will show both the upper and lower crowns in the jaw in one view. Generally, bite wings can come in 4 to 6 or 7 types of bite wings. Generally, they take a picture of what we know as the premolars, and then they'll take a picture of what's known as the molars. The molars are wider. The premolars, being they're in front of the premolars, and they're usually smaller. So when we look at just all the films that are laid out here, just find first where is the ones that show crowns on the top and the bottom. And we have found those. There's 4 in this that show top and bottom. When we look at the film mount and you want to position it so that the labeling is facing you, if the identification dot is up, this side, whether top, middle, or bottom, is the patient's right side. Whether it's top, middle, or bottom, this is the patient's left side. So we read the film like you would read a book. This starts on this side of the patient's right, going right across. This would be the bite wings. This would be the posterior periapicals, the anterior periapicals, and posterior periapicals. So this would be the patient's right maxilla, left mandible, and right mandible. So keeping this just the way it is, we want to look on the bite wings so that we can make the patient's smile. Notice the patient has a smile. We want premolars in front of the molars. So I'm going to look for the films that show the top and bottom teeth of the premolars. And this film shows premolars, this film shows premolars, this one does, and this one does. But this film shows more of the premolars than the molars. So again, it's making a smile, and so is this one. Once we can find the films that show most of the premolars, we're going to put them in the center as they would go closest to the middle, right in here, of your film mount. And again, the molars would go further in the back, similar to how it's orientated around the patient's mouth here. So again, this would be the molars because it's showing more of the bone in the back. Generally, molars can be 1, 2 to 3 molars. Premolars are generally 2 on the top, 2 on the bottom. Premolars also may show the pointed canine on the tops and the bottom. So we'd have our bite wings in line here. The next step that we would look for is our posterior periapicals. Posterior would be the back teeth, both top and bottom. Some helpful anatomical hints for you. Generally, the maxilla is a jaw that's hollowed out by sinuses. So the appearance, when we look at the periapicals that are black and white, they look like there's a black cloud with a white lining above the roots of the teeth, whether it's the premolars or the molars. Whereas the mandible is very thick jaw and is not hollowed out by sinuses. The other important feature is the maxillary molars, whether right or left, have 3 roots with a cloud up above it, a hollowed out sinus. Whereas the mandibular molars have 2 roots that we would see. Generally, you want to orientate your films so that they anatomically would have the roots of the mandible going down and the roots of the maxilla coming up. So the cloud should be going up. So here is a cloud up. Here's a cloud. This one has a cloud. We can see in this view a cloud. And then we can see some that is orientated for the bottom views. Again, we've got another cloud and a cloud. We've got 2 roots for the mandible here. 2 roots for the mandible here. Notice, again, in your film holder, the films for the top, this would be your maxillary molars, maxillary premolars, maxillary left premolars, maxillary right premolars, and this would be your left mandibular molar, left mandibular premolar, mandibular right premolar, mandibular right molar. When you look at your films, the molars should also be able to show, just like your anatomy, some of the distal bone in the back would be shown on a molar view, whereas a premolar view is going to show more of that pointed canine appearance here, whether it's top or bottom. The last types of films that we would want to orientate would be our anterior periapicals. Again, anterior being the front view, periapical being around a root of a tooth. So again, we'd want to look for films that show the crown and the whole root of the tooth. Remember, I mentioned to you that on the maxilla it is hollowed out by maxillary sinuses in the posterior area, but as we come towards the front, we have the nasal cavities. So it will appear like, again, a white lining with a black cloud up above. So we want to look at our films that have an appearance of having a white line that are very dark cloud up above the white lined area. And again, our mandible is thick bone. So again, like I said to you, orientate them so that the roots of the mandible are pointing down. And then you want to have the roots of the maxilla pointing up. The hard part of the anterior periapicals compared to mounting the other films are, now we have to orientate so that we get the central incisors in the middle frame or window on the mount. And then we would go central incisors. The teeth beside the central incisors are the laterals, and then you'd have the canines. Now, if I had 5 frames or windows up above here, I could easily do centrals, laterals, and canines on both sides. But we only have 3, so probably we're going to have centrals and some laterals here, then probably a lateral and canine here, and a lateral and canine here. So we want to look for that, depending on, again, our film mount. I can see by the picture view of this film I can see both central incisors. So that's going to go in the center frame or window. Then I want to look for a tooth that's lateral, not as wide, not as wide in width, known as mesial and distal, as the central incisor, would be the laterals, the right and left laterals. The pointed film, where it looks like the crown is coming to a point, is the canines. The canines. And if orientated correctly, generally your identification dots should be located down at the crowns of the teeth. We would do the same for the lower teeth. You want the centrals and laterals, which generally mandibular teeth, the roots appear smaller, the crowns will appear smaller. They will be pointed down to the bottom. And then you'd want the canines on either side, laterals and canines. Once you have orientated yourself with all of your film laid out on your view box, then you're ready to actually put it into a film mount. I caution you, when you're placing it in the film mount, place the film mount so it's in front of you, that you can see the labeled area. Remember I said to you, anteriors will be placed in the film mount in the center, posteriors are on the side. This is the upper jaw, all the maxillary teeth. This is the lower jaw, the mandibular teeth on the bottom of the film mount. The bite wings go in the middle. When you flip the film mounts over, realize they slide into the slot, but do it while you are actually facing yourself and placing the film into the slots. You will have an opportunity to practice this during your lab. You'll have many opportunities within the next 6 weeks. You will be presented with a packet. We have many packets for everybody to experience with, where there will be a film mount located in there and a coin envelope with film. Could be up to 20 film in there. You'll place the coin envelope onto a view box, and then you will orientate based on labial film mounting that you were shown in this video presentation. Once you have mounted your conventional film, you will show it to your lab instructor, and then you will continue to practice this. This gives you a demonstration of film mounting and an orientation to film mounting. Further tips and suggestions will be provided to you by your book, Chapter 28, as well as your lab instructor. Thank you.